Yeah, hello everyone. Welcome to the spotlight session of the 2023 Health Longevity Global Innovative Summit. My name is Chenxi Ouyang from Beijing Fuwai Hospital, and I have received the Catalyst Award in the last year. Today, I'm going to introduce my program and the synthesis and the assessment of the thermoplastic polyurethane elastoma, the basic material applied in cardiovascular prosthesis for the aged. Now, first, let me introduce myself. I'm the Chief Surgeon of Fuwai Hospital, Chinese National Center for Cardiovascular Disease. My research direction is about the translation and the innovation in cardiovascular devices, especially the vascular prosthesis and the medical plastics. I have been as the visiting doctor by Hannover Medical University in Germany for 3 years, and also the visiting professor by Stanford University for 1 year. Now I will brief to present my presentation for 4 parts. The first part is about what's the TPU. It is the thermoplastic polyurethane elastoma, a type of polyurethane elastoma and a kind of linear block copolymer with the ABN type. Its softer segments and hard segments align alternative with the carbonate bonding. Here we just show the kind of regular softer segments and diisocyanates, including the PTMO, PCL, PDMS, and the silicon, PIB, and etc. Now, what can we use in the medical devices? Generally, it can be used in the to fabricate vascular grafts, heart valves, and medical tubes, and the catheters, and other devices. For instance, the biodegradative materials, shape memory materials, and so on. Now, what's the scale of the markets of the medical TPUs? Well, for the whole world, medical TPUs have relative higher prices than the general industrial products. And the growth rates of the polyurethane, for example, is about 6.8%. With 25 million tons capacity. For China, in China, the capacity was about 8 million tons, worthy of 200 billion yuan per year. However, there is no commercial products by now in China, especially the biomaterial polyurethane material. Now, a technical breakthrough is also needed to meet the demands of the coming aged society. And especially, the scale of the market is growth quite quickly. The demand of the artificial blood vessel, for example, in the world is about 500,000 pieces, and 10 billion yuan per year, and the medical catheter market in the world is also about 100 billion yuan in 2023, with a 10% growth rate expected. And the worldwide scale of the TPU is growing, especially the mitral valve regurgitation and aortic regurgitation and aortic stenosis, and the market is also very huge. So we need to work hard in this program and to cooperate with the industry of the chemistry, the Chinese Academy of Science, and also the Chinese Academy of Medical Science. This is also both are the top scientific research institute in China. And we also cooperate with the Ningbo Beiyang Biomedical and Wuhan Yangsen Biomedical, these two famous manufacture industry in China. And we also funded by the municipal government of Ningbo City in Zhejiang province. Now I will introduce about the chemical and the physical properties of our program. As we know, the TPU, we showed you only part of the chemical and the mechanical properties of the synthesized TPU because of the time limit. We choose one step methods to synthesize PCUs. The PCU is the whole name is the polycarbonate polyurethane. A different kind of the chain extended when designed to find the optimal types of the synthetic formula. Through the FTIR chain structure of the TPU's vascular graft before and after the implantation for 24 weeks was released. It helped us to define the type of the soft segments and the hard segments. As the mechanical properties, we got PCU MEA with a high stress modulus, Young's modulus. We also catheterized the micro. We also catheterized the macrophase separation via AMS and in the CQ6-8 Beijing electron electron positron collider. We found the fibrous crystal aligned when stretched in PCU video and PCU MIA. Finally, we made of this kind of small diameter. We made of this self-synthesized solution, and the conduit met the requirements of the manufacturing processes. And this is the blood vessel we have produced in the factory. And now let me introduce the biocompatibility of our products. First, we will show you the good biocompatibility of the medical TPU we synthesized. In vitro cytotoxicity test showed there is no toxicity of the sample. Sorry. And the second is that the blood vessel, the hemolytic index of the PCU were less than 2%, and indicating that there is no hemolysis and good hemocompatibility. Finally, I will show you how about the PCU was less. How does it works of our PCU made the vascular graft, and we implant the vascular graft in the animal to replace the aortic artery, and after 6 months operation, we opened a vascular graft, and we see there is no degeneration of our vascular graft, and there is no thrombosis in the inner side of the vascular graft, and the result is really very good. Now I will finally I will show you how about the translation of our program. First, we have got the financial support of the municipal government of Ningbo City, which is located in Zhejiang province in east of China. And we also translate our patents and the techniques to the Ningbo Bayon company, which possess about 1,800 square meters GMP workshops and the office area, and it also have the whole assembly lines and the testing equipments for the manufacturing of the TPU products. And yeah, and especially this is the very important machine to produce the TPU products. It is called a twin screw extruder for the medical TPU synthesis. And now our TPU's products by Bayon company includes the liquid TPU and the PCU and the silicon mixture, and all these products can be used in the vascular graft and the heart valves and the medical coding and the catheter and orthodontic brace. Okay, that's all. Thank you very much.
Thank you very much, Dr. Yang, for that really helpful overview of your project, and congratulations on the success of your expansion and the fundraising efforts. Just thinking about your experience with fundraising, can you share any guidance with fellow Catalyst awardees that might be seeking similar types of support as the ones that you've obtained?
I'm sorry, can you say it again?
Can you share any guidance or advice for other Catalyst awardees who might be working to obtain similar types of support or funding as you have in the past?
Yeah, okay. First, the most important is that we need to find exactly the pain point for our clinic. Is for example, now we found that all the medical devices need the materials. The raw materials is the most important for the quality of the medical devices. So we find this point, and this is also very pain point in China, because by now there is no commercial polyurethane, medical polyurethane in China, and so we need to find out a better way to get out this kind of materials, and so we just cooperate with this very good scientists in China, because this kind of area is really very hard for Chinese medical resources. So without the chemical scientists in the top level institute, we cannot solve all the problems in this program. So, and the good cooperative, the good partner, yeah, is very important, and the good pain point is also very important if you want to get financial support from the government. Okay.
Thank you. No, that's very helpful, and thanks for that insight on your project. I think it probably applies to a lot of different projects under the initiative. So thank you so much again for sharing about your work. We really appreciate it, and I would like to ask everyone to hang on for a quick break before we move into the last session, spotlight number 3 of the day. Thank you.
Yeah.
Thank you, Dr.
Okay.
Yang.
Thank you. Yeah. Thank you very much. Yeah.